neck and back pain, acute pain and chronic pain is what we're going to talk about here. Don't miss this show. Stay with me. We're going to cover a lot. If you have any pain or if you know someone that does, this will give some answers. I want to talk about causes of neck and back pain. I'm going to talk about our approach in dealing with that, which gets specific to people. I want to talk about how we got there, what happens to our bodies and our spine to get there. I want to talk about a couple of other ideas towards the end. One of them is inflammation, and another one is something that people miss when they are talking about this. That will be the last thing we're going to talk about, so that will be a surprise towards the end. So neck and back pain. Remembering that Judy Foreman wrote the book A Nation in Pain a handful of years ago. She gave some statistics. Out of 238 million American adults, over 100 million are in chronic pain. Adding to that, the number one body part that has pain is the lower back. That's the number one body area for pain by far. Number two and number three are pretty close. Number two, neck pain. Number three, headaches and migraines. Well, those happen to be the three most common reasons that anybody calls my chiropractic office: low back pain, neck pain, headaches and migraines. So we need to understand it's so common, it's so prevalent, and so terrible to quality of life. What is causing it? And that's the first thing I want to talk about here. What hurts? And the answer is surprising to a lot of people. It's not muscle. So when we look at the spine, taking the spine out of me, when we look at the spine, you see the bones here. For the most part, the bones are not going to cause pain unless they're broken or they have cancer or something else is going on. Almost all cases, the bone is not causing pain. The muscles that are surrounding the spine that stabilize us and allow us to move, those for the most part are not the generators, especially of chronic pain. What's left? Well, deep inside the spine, you've got the discs. The discs are the cartilage pads between the bones. Those cartilage pads are between each bone of the spine. Think of it like the cartilage in your knee, right? The meniscus pad of your knee. These are pads in between the bones. When they get inflamed and irritated, they are often the cause of chronic pain. Now, this is something that I talk to all of my patients about, unless they're 3 years old or whatever, but I talk to them also so they can understand. And I talk about this in my workshops in my office. And of course, I've talked about this numerous times on this show. The discs are the cause of pain. As I say that, a lot of you might be thinking, oh, okay, I have a slipped disc. I must have a herniated disc. I must have a bulge disc. I must have a prolapse disc. Not necessarily. As a matter of fact, a lot of you don't. So researchers grabbed 100 people off the street that had no back pain and no history of any back pain. They did MRIs on these 100 people, MRIs of the lower back. 50 of them had significant disc pathologies and problems on MRI and no pain. They had disc herniations, prolapses, bulges, and so forth, degeneration and arthritis and everything, but no pain. I had a patient earlier that I like to mention to you who is 30 years old, has had on and off low back pain for a few years now, and I've been working on him, and we made some progress, but not full progress. His doctor ordered an MRI. I said, I don't think you need an MRI. We're not going to be seeing anything on there. Sure enough, the MRI comes back completely, totally normal. However, with that information, I said, you have disc pain, even though the disc looked completely beautiful on MRI, and the radiologist said, normal study. Then we had a smart surgeon who said, hey, patient, you need back surgery. During the surgery, we're going to figure out exactly what's causing your pain, okay? Patient says, okay. He sticks a needle on the skin. Asks the patient, does that hurt? Yes. Is that reproducing your pain? No. Anesthetizes the skin, exposing muscle. Gooses the muscle. Does that hurt? Yes. Does it cause you, is it reproducing your back pain? No. Goes deeper. Deep muscles, bone, joint. It stabs everything. Is it painful? Yes. So these things cause pain. But are they reproducing the pain that that person has? No. Until that surgeon got down to the disc and hits the offending disc, like that. Oh, yeah, that's it, doc. But he didn't do it on one patient. He did it on 700 volunteers. Would you like to volunteer for that? 700 volunteers. The cause, what hurts? The cause of pain is irritated discs, specifically in the lower back. In the neck is slightly different. In the neck, chronic pain is caused by the disc, the pads in between. But on the back side of the spine, other joints, you have 2 joints at each level. The joints allow us to move. These joints can cause pain as well. That's what's causing your pain. If you have pain that lasts more than a couple of days, it's not your muscles. We go to the gym, we lift some weights, we're sore for a couple of days, and then it goes completely away. You never call your doctor for it, you never question what's going on. Post-exercise soreness has a particular sensation to it, and every person that comes into my office that has neck or back pain, I ask them, is that the type of pain that you're having, post-exercise soreness? They say, no. They say it's completely different. I say, that's true. So then I say, it's disc pain. Okay. So next up, that's what's hurting in your body, discs and joints. Well, how did it get that way? Why did all of a sudden somebody will come into me, like the patient I'm thinking right now, the woman in her 50s, a nurse, great person, wonderful, wonderful person, comes into me and says, my neck and back hurt. It's been 2 years, and now I can't do stuff. Now it's time to come see you, and the regular home stuff didn't work. I also like to say that if home remedies worked, I wouldn't have a job. I would just show people stretches and say, have a nice life. I would say, drink some water and get your hydration up and have a nice life. Go eat vegetables and have a nice life. So that's not what happens. So people come in to see me when their home remedies don't work. And so we did our workup. We included some x-rays. We saw that her spine is out of alignment and so forth. We saw that there's arthritic degeneration in her spine. No surprise to her. She's an ER nurse and she's been doing that for like 30 years. So she was able to read x-rays. We looked at them together. I showed her where the alignments were. Now the medical radiology report talked about the arthritis and degeneration, but didn't mention anything on alignment. And I told her this, and I said, I'm going to go to the next step, and I'm going to say, here's your alignment issues. When I put the x-rays up on the computer, she said, oh, well, you can clearly see it's out of alignment. Okay? It had been like that for 57 years, but nobody told her that, and she didn't know to get these things looked at and checked. So I said, here's your alignment and position. We need to move it closer to the normal alignment as well. So when we took a picture of her neck, which is supposed to have that nice curve in her neck, she had a reverse curve in her neck like this, bending the wrong way. And I said, it's been like that for decades. That's like driving your car on a misaligned front end. Of course, the front end parts are eventually going to wear down, and the tires will wear down. They don't wear down in 100 miles or 1,000, but give them 20,000 miles, and we didn't maintain the car, and all of a sudden the wear and tear reaches the breaking point where the car starts to make noises down the highway, squealing around the corner, and so forth. And then you bring it into the mechanic, and the mechanic says, well, it's been out of alignment for such a long time, all the parts are worn down, and now they're creating symptoms, and now they're creating pain, said the mechanic. So what happens, says the mechanic, is you've been out of alignment so far and so long, eventually it created pain. And that's what I explained to her, and she's like, got it. Luckily for us, and this doesn't often happen, I did my chiropractic magic on visit number 1, and she comes in the next day and shakes my hand and says, thank you very much. I said, you're welcome. And she said, last night I slept better than I have in years. I feel better today. Clearly not out of pain, but I can see that we're on the road to recovery already. I'm like, that makes my job a lot easier. When somebody sees results after having pain for 2 years, and I work on them once and they can see an improvement, I was like, that's good, that's nice. Okay. So how does the spine get into this position? A lot of cases, like for instance, when I saw the early 20-year-olds recently as patients, and I start looking at their spine and we see misalignments and so forth, we see curves that weren't established. It never were established from day one, from birth and our early development. So when we're first born, we are born with one curve in our spine called the fetal C curve. We have one curve, this, if you will, thoracic kyphosis. The neck curve and the lower back curve Our secondary curves, they develop after birth for muscular action. So when we're bobbing our heads around, we start looking up like this, all of that muscle effort for many, many months and a few years creates the neck curve. And then when we start crawling, we start to develop the lower back curve, but it's not fully developed yet. That's why when toddlers are walking, they walk with a waddle and so forth until that curves come into play, and there we go. Now, if that curve development doesn't happen appropriately then and there, then that's going to lead to problems down the road. Childhood falls, crashes, bangs, and so forth can cause that. Falling out of the crib and falling off the playground equipment and whatever it might be, learning how to walk and run and crashing into things, and then we misalign the spine, but nobody gets it checked at that point. As the twig is bent, so grows the tree, and then the tree comes to see me, and I said, well, a lot of these things probably happened back when you were in a twig. Now, of course, it can happen with other injuries. Sports injuries, car accidents, and so forth can tear things, and then they heal like this, and then we wonder what's going on. It's the basketball player that sprains the ankle multiple times in their career, 20 or 30 years later. That ankle that was repetitively injured and healed with scar tissue and so forth gets stiffer, weaker, more arthritic, swollen, and so forth. It reacts to barometric pressure changes with weather more than other joints that were uninjured, right? Chronic pain, people can tell me 12 hours before the rain rolls in, hey, my back hurts more, my neck hurts more, my knee hurts more. It's going to rain in 12 hours. And guess what? I always have to pack my umbrella because they're always right. Barometric pressure sensitivity, another indication of a chronic pain problem. Oftentimes it's necks and backs that does that. Follow? Okay. So what do we do? What is our individual approach? So that's the next thing here that we want to talk about. We know what's causing pain. We know it's irritated discs and joints deep in the spine. We know what causes this over time with basically life. And the other part of life too is not only injuries and traumas and slips and falls, by the way, it can happen slowly over time. Try this experiment. Sit in front of a computer 8 hours a day for 45 years. Let me know how your spine is doing at the end of that without any care, without any evaluation, without any magical exercises, without any chiropractic care. Let me know how that spine is doing. And for most of us, it's not doing so well. So it's either an injury like that happens instantaneously, or it's a slow wear and tear process of not paying attention to posture and so forth, sitting in front of a computer and phones, and there we go. You add all of that up, and there it is. Okay, so number 3, what is our approach to this? What is your condition like, and what is our approach going to be for you? We try to do this as individually as possible. I'm going to give you a few examples of how we handle people that are coming into this chiropractic office, and I'm going to give you a little bit about how I think. Backing up a couple of notches, when I was very young, I remember my dad crawling to the bathroom because his back was so bad. And this is in the early 70s. Chiropractor put him back together again. He was under chiropractic care for the rest of his life. My mom was working retail, and this is the 70s and 80s, so she's working retail in high-heeled shoes, standing all day long, messing up her back and her discs in her lower back, getting lower back pain and sciatica pain down the back of her leg. Chiropractor helped her. She was under chiropractic care for the rest of her life. The two of them were so impressed with their chiropractic improvements that they started bringing in the kids for chiropractic wellness care. Pretty forward thinking for the early 70s, right? When chiropractors were still practicing witchcraft and smoke and mirrors and so forth. So anyway, we started going to the chiropractor as kids, and I thought it was really kind of weird but kind of neat. And I remember going to with my mom once a month to the chiropractor all through grade school and high school just for tune-ups. So I've been under chiropractic care for 46 years. And then I decided to become a chiropractor. Now, in my experience now 30 years, and my experience with my own spine and taking care of my own spine, is that I understand now very clearly this exercise does not work for all people. That treatment over here does not work for all people. This adjustment that worked magic on that person, I tried, hey, we have to do it. Your condition seems to be similar. Let's try that adjustment on you. Didn't work for that person. So I realized then that we have to approach each person differently. And that's what we do coming into my office, is we look at you as an individual. So we do the history, we do the examination, we do the orthopedic neurological checks as appropriate, we do the chiropractic analysis and appropriate checks as well. We look at posture, we look at alignment, this way front to back, this way from the side. If necessary, we will order up x-rays. And boy, I can tell you time and again, when we take x-rays on people, and oftentimes in the neck, we might only need like 3 x-rays. On the lower back, oftentimes to get started, we only need 2 x-rays. That is often enough to give us the information that we're looking for. And I have seen congenital anomalies. I have seen things with these anomalies that says, don't do any of this certain chiropractic work. I have seen anomalies that I have to tell the high school wrestler with neck pain, I have to say, you can't wrestle anymore. And I've had to have that discussion with people. A chiropractic colleague of mine who is an ex-football player had a high school football player come in and said, when I tackle people, my hands tingle. Take an x-ray, congenital spinal stenosis. Unfortunately, my colleague had to tell the football player, you can't play football. We have to find something else. So sometimes we reveal things on x-rays that are very important right then and there to give us information. And unfortunately, I've seen other causes of pain, which can be cancer, which can be fracture, which can be other congenital anomalies that give us the information we're looking for. But in a lot of people's cases, what we do is we start to see alignment. This is where it gets individual, and this is where our approach comes in. We look at somebody from front to back, we look at their posture, and then we take x-rays. Sometimes we see this, sometimes we see that, sometimes we see a couple of them, right? Sometimes we know beforehand that somebody has scoliosis because it was caught when they were a child, but now they're an adult, but now there's chronic pain. And now we know that we have to deal with this differently than somebody who has a spine that's like this, okay? So I have a woman who is 38 years old, and she came to see me just a couple of weeks ago, first time to a chiropractor. She knew she had scoliosis. It was caught when she was a young child. She wore a brace for many, many years. But now she has a 50-degree curve down here in her lower back. Actually goes that way. And then a 30-degree curve up here. Second worst amount of scoliosis curve that I've ever seen. And her back hurts. Kind of makes sense. So we're going to put her on a program here of dealing with the acute pain that she has more recently. And then we're going to try to manage this for the rest of her life. We'll never get her straight. The oak tree is grown. The twig is what it was. If I saw her at age 7, maybe we could have made some changes. But now at 38, we're not going to make any changes in there anymore. But we're going to manage it really well. And I've told the story of the woman in her 40s with a 64-degree scoliosis. By the way, this would be 0. And if you're watching this and understanding a little bit about spinal alignment, scoliosis only refers to the front to back dimension. This is scoliosis, okay? This is not scoliosis. This is just bad posture. So scoliosis only refers to looking at the spine straight on. So this woman that I'm talking about has a 64-degree curve in the middle back area. Chronic pain, not a surprise. We worked on it for 6 months. We got her pain-free. She still had a 64-degree scoliosis. I can't change that, but boy, we can manage it well. And that was many, many years ago. And she was coming in for maintenance care once a month. But here was another key, not only in the maintenance care, because she could feel stiffness and aches kind of build a little bit as she got closer to that once a month appointment with me. But she did her exercises twice a day, every day, never missed. If she went on vacation, was out of her normal regimen, and she missed her exercises, much worse during that week. But as soon as she got home, got back on that regimen, it helped her. Can you see? So you're starting to see that part of our approach is not only the short-term pain relief, but if somebody wants more long-term prevention and ideal health and wellness, we can implement those tools and skills with an occasional oil change and tune-up in my office. and then knowing how to drive the car appropriately and check the oil and wash it and wax it and not drive off-road and so on and so forth, caring for your car in between those tune-ups as well. Or in the case of the spine, we're giving people specific spine exercises and so forth. Part of our approach is understanding, as I said earlier, not all exercises work for all people. Do you think that yoga is good for most people? Of course, it's a good idea, right? Working on flexibility. Is every yoga position or asana good for every person? Absolutely not, and I found that to be the case, and so have many of my patients. So if I'm lying on my tummy and I push up and I do up dog, my back hurts. So if I do yoga, I don't do that position. I go and do something else. I'm a yoga pansy, so I just do the things that are comfortable for me, and I school and help and nudge people to do those same things. No matter if the class is doing this, go do that. Nobody cares you're making those modifications. So modifications are important. For some people, I will tell them, oh, the knee roll exercise, rolling your knees side to side like this, best exercise for your type of lower back. And they go home and they're like, you know, I really don't like that one very well, or I can't do it right now because it causes pain, so we have to modify that. You follow? So that's part of the individual approach. We'll take x-rays of the neck from the side. We might see that somebody has a good curve, so we're not paying attention to that. Maybe it's a lot of forward head shift that we need to pull backward like this, so we need to do chiropractic adjustments and exercises that promote this. Maybe someone like the 25-year-old woman that has neck, 25-year-old, by the way, with neck pain and arm pain now, sitting in a computer, and it's really bothering her, and she's keeping her up at night now too. We take an x-ray, complete reversal of the curve in her neck. And I show the x-ray, and I say, can you see the problem? And of course, I have a poster next to it of the proper position. She looks and looks and looks and like, wow, that's way off, isn't it? So we get into that, and I said, well, what we're going to be doing is doing this. Does this make sense? A lot of chiropractic adjustments, exercise, and awareness to move that curve in the right direction. And she says, yeah, that makes sense. And I've worked on it 3 times, and she's starting to feel a little better. Well, her husband comes in, and he's 25, and he's had off and on low back pain since a teenager, and now the pain is much worse because he has a hard lifting, bending job. So I take x-rays of him, and I take the x-ray of his lower back from the side. It should have a nice curve like this. He's got a loss of curve in his lower back, a loss of curve. Now, when you have a loss of curve, extension exercises can be very beneficial. I have too much curve like most people, so when I do extension work, my back hurts. So I do more flexion work and so forth. I'm still working on posture, but I don't do extension work. That's part of the individualism that we go into when we're working with somebody that has chronic neck and back pain. The 8-year-old that has migraines, I'm going to work that up a little bit differently than the other people that I just talked about. The 38-year-old with scoliosis, the mid-40s woman with scoliosis, the 2 25-year-olds that come in, one with neck pain, one with back pain. But I have an 8-year-old come in with migraines. And the good news is before that young man came in to see me, he already had his CAT scan, because it's not normal for an 8-year-old to have migraines, right? So he gets his CT scan, and there's no big bad boo-boo in his brain, and that's very good. But they didn't know what to do with him. Now, he had no neck pain, but as I'm looking at his range of motion and do my palpation, as I've told the story many times, he had a big knot in his neck right here, and I pressed on it, and he said, wow, that really hurts, and that makes my headache worse, right? So I start working on his neck, no neck pain. By the way, I took x-rays of his neck as well. Actually, in his case, we might have even used the CAT scan images, didn't even need new x-rays, because the CT scan caught part of his neck, so we were able to extract the information we needed off of there. So we gave him specific exercise at home. I did my specific chiropractic work and adjusting in the office. Sure enough, off the migraine medications, migraine free. He stopped missing 22 days of school per year because of the headaches that he was having. And now he's in high school senior or something like that with no headaches, and he's doing really great. So that's the individualism of him with migraines. And then I think about the 95-year-old man that came to see me last year, first time going to the chiropractor, 95 years old. He drove his way to the office himself. He comes in, and he's got back pain. His son, a doctor, who's in his 60s, calls me and said, hey, will you look at my dad? I said, sure. So dad hurts his back putting on stockings because he has a little swelling in his legs and those aren't easy to put on, so he's bent over wrenching himself like this and pulls his back. I worked him up differently. We only did sitting treatments. He never laid on my table. He couldn't. He was too uncomfortable. But I was able to work his spine when he was sitting with my chiropractic work. Gave him a couple of simple things to do at home. I gave him the ice speech. The ice speech I've talked about in prior shows here in this show, where I said, stop putting a flamethrower on a fire, which is heat. Put ice on it, anti-inflammatory, as long as somebody doesn't have a circulation disorder that they can't tolerate ice. And so we switched him over to that, and sure enough, in a few weeks, he's doing fine. So I worked him up a little bit differently. And that's what we do when we come into the office after the evaluation. We look it over, and there we go. Now, the other thing about particularly chronic pain, these people coming in with chronic pain, they're not going to be getting better overnight. This is a process. When you sprain your ankle and you go to physical therapy, you know you're not going to get better in a day or likely in a week. It's going to take many weeks for you to get better. I tell people that because everyone's always able to wrap themselves around a sprained ankle. They know it's not going to get better tomorrow because they're hobbling around today. Well, the same thing with chronic neck and back pain. It's not going to get better overnight. For most people, it's a journey. If I could get everybody better in one visit, I would do it. I would charge $10,000 a visit, and the line would be out the door and down the street to see me because they know that they come in and they get well for life in one visit, and there we go. That would be awesome if I had that magic and power, but I don't. However, for most, not all, but most people, if they go into that journey and they start working on this, then it gets better and better. I'm not pain-free all the time. My back hurts if I sit too long or stand too long, but I manage it really well. I do the same exercises you've learned from me every day. I go to my chiropractor once a week, and I change my ergonomics, and there's the things that we do in that individualism to do that. But here's the last two things that we do. And these are the things that people with chronic pain need to know. Some people do it, some don't, because it might be hard, might be perceived as being hard. The fourth thing is inflammation. Inflammation, look it up. Do a Google search, look on YouTube. Inflammation. Inflammation is systemic activity, negative activity going on in your body. You've got 50 trillion cells. If they're all inflamed, bad things are going to happen. They're not going to work right. Your physiology is not going to work right. What are the biggest things, triggers of inflammation? You already know what it is. If you eat things that taste good, bad inflammation happens, okay? If you eat real food, you reduce inflammation. If we have the SAD diet, the standard American diet, the SAD diet, inflammation goes up, increasing chronic pain, leading people down the road from over-the-counter medications. They don't work anymore, prescription medications, then to opioids, and now we have an opioid epidemic, right? So we need other answers. Chiropractic is a great answer for many, many people because we can knock pain down and some people relieve pain. And if people are taking less or no medication after this kind of work and this path, then we're doing great things for people. Knocking down inflammation requires that improvements in nutrition, general physical exercise to your tolerance, spine exercises to your ability and tolerance specifically picked for you, getting more rest, drinking enough water, getting away from inflammatory foods, not having any soda, staying away from all diet products, all diet soda, sport drinks, and so forth. Any of the fake sugars and sweeteners and all this kind of stuff, getting away from all those inflammatory causes, right? Reducing chronic stress, more on that in a moment. Reducing these inflammatory lifestyle characteristics, and that's going to give you a chance of having less pain. So when I talk to patients that come in and they're maybe getting a little bit better with the chiropractic and the exercises, but they're not getting fully better, then I start going down on the train. Okay, let's look at your nutrition. Let's look at your water intake. Let's look at your sleep. Let's look at your stress. Let's try this low-level laser that we have. Let's look at all of these things. Let's look at your general physical exercise, your spinal-specific exercises. Let's look at some anti-inflammatory supplements. Maybe we can knock down this inflammation, which is going to help you live a better life. The last one is the thing that a lot of people don't link up to chronic pain and chronic neck and back pain, and I've got the best story for you, the best story about stress. The best story about stress. I have a new patient to me. New patient. She is 69 years old. New to me. She has back pain. Her back pain has been going on for 3 months. She gets 5 to 10 really bad back spasms per day. Like stop you in your tracks, stabbing pain. Who's stabbing me in my back, right? Some of you might know what I'm talking about, right? Stabbing back pain. And so we get into the history and I'm getting to know her and what's going on and so on and so forth. And she says, you know, I think it's stress. Okay, so what's going on? Well, I had a vacation. I was gone for 3 or 4 days. No back pain at all. No back pain at all. I come home, there's some family stress in her life, pain comes right back. I work on her, I do my chiropractic stuff on visit number 1 last week. She comes in this week. You know, I did a little bit better after that. I had a day off, no pain. I was great. I was away from home. Then yesterday my pain was terrible. I had stabbing pain last night from 10 over 10, stopped me in my tracks, frozen, I can't move. And I had the stress. Today, I asked her, do you have any pain today? No pain whatsoever. I have no pain. I said, why? I'm away from home. I'm doing good. Okay. She says, I think it's stress. I think you're right. So then I would send her to my YouTube page. I send her to my cable show. I send her to my handouts that I have in my office on handling circumstances with better gifts. Code word for stress reduction, right? Having more tools to better equilibrate the circumstances that are going on in our life right now. In other words, having tools and techniques to handle the circumstances that we have. We might not be able to change circumstances, as I tell her and everybody else, and I work on this myself all the time. Might not be able to change circumstances, but you can change your reaction to a set of circumstances. You can change your perception to those circumstances, and that's what that is all about. You can clearly see in her case, she can clearly see in her case, what she's thinking about is causing stabbing pain in her lower back, but when she's not thinking about that, her back pain is now gone. Isn't that interesting? So here's where we are. If you have chronic neck and back pain, there's quite a plethora of things that we can do and offer in the chiropractic setting, and I think a little bit outside the box, where I'm doing the chiropractic thing and the spinal exercise thing and the ergonomic thing. That's our standard protocol. But then we do the evaluations and we make more specific recommendations for you. And then we can talk about inflammation and stress if we need to, and that can help you have a better quality of life because it is all about health span. I'm Dr. Scott Fuller.